Hi, my name is Ed Loftus. I'm a gastroenterologist at Mayo Clinic, and I specialize in the care of patients with inflammatory bowel disease. And I wanted to talk to you today about an article that was in the December 2014 issue of the American Journal of Gastroenterology. And so this was a study performed in Canada. It was using a database of sort of billing data or claims data in patients with IBD, and they were able to devise an algorithm to identify new IBD patients within this very large database between 1996 and 2009. They found over 5,000 patients, and these were patients that had a new diagnosis of IBD and were over the age of 65, so older onset IBD patients. And then they looked over a 4-year period, an average of 4 years, and looked for evidence of serious infection. And serious infection was defined as an infection that prompted a hospitalization. And so then they did a case control study within this cohort of patients. The cases were patients, these elderly onset IBD patients who had a serious infection, and the controls were the elderly onset IBD patients who did not have a serious infection. And each case was matched up to 5 controls. So they had over 500 patients who were hospitalized with a serious infection who were the cases, and they had over 2,500 patients who were the controls. And they looked at factors that were associated with serious infection or hospitalization for infection. And it turned out that the biggest factor was recent corticosteroid use. So the patients who had received corticosteroids within the 6 months leading up to the hospitalization were 2.8 times more likely to be hospitalized for a serious infection. If you looked at just steroid use within the last 6 weeks, the odds ratio wasn't quite as high, but it was still elevated. It was 2.3. So this is telling us, in other words, that elderly patients who have IBD, who take corticosteroids, are 2 to 3 times more likely to develop an infection that's serious enough to require a hospitalization. And I think this is important to point out. Steroids have been around for years, so we all feel familiar with prescribing them, but they're also associated with important side effects, and we need to consider ways to get our patients off of corticosteroids. I'm not saying we can't use corticosteroids, but we need to use them judiciously and for short periods of time, and think of ways to get our patients off corticosteroids, and that might mean the use of immunomodulators or biologic agents. Thanks.